Turning to some health news now, the use of antidepressants is on the rise, but a new study looking at the impact of these drugs on healthy people shows if you're not clinically depressed, there could be serious repercussions. Dr. Chuck Williams is an educational psychologist and director of graduate studies at Lincoln University, and Dr. William Cooper is a professor of pediatrics and health policy at Vanderbilt University Medical Center and has done extensive studies on antidepressants. It's nice to have you both. Just for some context, 1 in 10 Americans over the age of 12 is taking some form of antidepressant. And Dr. Cooper, this is what the study found. If you give antidepressants to someone that's healthy, the researchers said it could actually make them feel more anxious and perhaps more depressed. Is that true?
Yeah, Jenna, that really highlights an important issue related to medications, that if you use a medication in a condition where the condition isn't present, it can actually have side effects that could be worse than the condition that you're treating in the first place.
Dr. Williams, how do you know if you're clinically depressed versus just have the blues? I mean, it's winter. I'm sure a lot of people feel that way. How do you determine that when someone actually needs an antidepressant?
I think working with someone like my colleague at Vanderbilt to do an assessment, to have an expert determine whether or not it's serious clinical depression, persistent, chronic, which may require some sort of intervention treatment, which may be pharmacological, like an antidepressant, like Prozac. However, part of the problem, Jenna, is that the majority of those persons, experts who are prescribing medications, don't know much about mental health. They're primary care physicians. You come in, you say, I'm not feeling bad, I'm not feeling good, I've been feeling bad for a couple of days, a couple of weeks. You know, they write you a prescription, next thing you know, you're popping pills. And they normally don't even refer you to a mental health professional to get what we call the talking cure, which research says that the combination of talking cure and antidepressants, when appropriate for a patient, can have tremendous positive results.
And Dr. Cooper, this is echoing some of what you've found, that you've seen a large increase in the number of children and teenagers placed on these types of medications, and pregnant women as well, which I found interesting. I just had my first baby, and let me tell you, pregnancy is crazy. There's plenty of time when you feel like you might need medication, but to give a pregnant woman antidepressants and seeing that as more prevalent just seems a little shocking.
I mean, I think as Dr. Williams suggests, I mean, even during pregnancy, if you have depression and you need treatment with either therapy or the talking cure and medications, that's going to be helpful. But in cases where there's not really a clear diagnosis, it actually can create problems for both the mother and her developing baby.
How concerned are you, Dr. Chuck, even in your practice? I know you deal with a lot of children as well, because for example, even the statistic I stated, 1 in 10 Americans, I had to offer that disclaimer. It's 1 in 10 Americans over the age of 12, because teenagers are taking a lot of antidepressants, according to what we're seeing here anecdotally. How do you feel about that as someone who is trying to help people? Are antidepressants helpful, number one? And number two, how do you determine who gets them?
Well, Jenna, first let me do an ethics check and say that yes, as my colleague can attest to, for people who can use it, and if the physiological and pharmacological effects can work together, therefore there are minimal side effects and they feel better, they're upbeat, they're positive, things turn around, then it's a good thing. So it can work. The problem is it's an $11 billion a year business. So make no mistake about it. This is also about making money for big pharmaceutical companies. So they're pushing it on the primary care physicians to sell. They sell them these little trinkets. They have them traveling around the country. They push it to their patients. The pharmaceutical companies make money. You have a bunch of children walking around. They're like zombies. It's like The Walking Dead, 13 or 14-year-olds. Their gait is slower. They're avolitional. They're lethargic. They're not excited. They're not really passionate about anything. You have to be very careful, because antidepressants can wreak havoc on the brain and have a significant impact on a person's mood, which is not always negative, and the side effects can be also horrible.
Dr. Cooper, let me just end with you here on what Dr. Williams, Dr. Chuck had to say. How well have we studied antidepressants really? Because it seems that they've been around for a while, but the prevalence of usage has certainly gone up. Do we really know all the side effects?
I think we need more information. I mean, just like many drugs in children, we have medications that are available, and oftentimes people will use them in ways that may not be in the best interest. And so we have to continue to collect data to try to understand whether, for both, not for individual patients, whether the risks outweigh the benefits, and for whole populations, we need to have those answers as well.
Very interesting. We thought one of the reasons we wanted to highlight this is because if you're not clinically depressed, you are taking antidepressants, you could get on this kind of negative loop where you keep on taking the medication thinking it's helping you, but when in fact it may not be. So maybe some questions to ask. Dr. Chuck, Dr. Cooper, great to have you both. Thank you so much.
Thank you.
Thank you, Jenna.
Bad news if the medicine isn't doing what you think it's supposed to do.